Senator Burr.
Thank you, Madam Chairman. I've got to say, the last exchange was, oh my God, we haven't learned anything. And let me just make this point. I remember early on in this when the question of testing came up and CDC said, we do testing. And CDC demanded to do the test. And we lost weeks. And I'm not here to evaluate data, Tony, that's your job, and Rochelle and others. But to say we're going to make this decision based upon the research we've got going on at CDC, based upon the information that we've put out, and only our research counts, and to basically ignore the Israeli data or the Pfizer data. And I'm not suggesting that we're totally doing that. I guess my question would be, is Israel giving us transparency into their data? If Janet still lived in a world when we didn't accept foreign data for applications, which FDA's had the authority to do since 1996 when I changed the law, but it took COVID to actually make that happen. So I realize that we want accuracy, but do we really have to wait for CDC to complete the data? Do you think you're going to come to a different conclusion than Israel did? Share with me.
Thank you for that question, Senator. Absolutely not. We have to have collaboration across the globe because this is a global problem. So we've already had 2 conversations with Israel. We have data sharing from our collaboration, from our cohorts, as well as from theirs. We've also been in discussions with the UK to see what the data they have because, of course, they're several weeks ahead of us in the Delta variant. So we intend to leverage all of the data we have around the world to share liberally with other countries and in the hopes that they will share with us so that we can make the proper decisions here in this country and around the world.
Is there a reason to believe that the Israeli data is flawed?
I'm sorry?
Is there a reason to believe the Israeli data is flawed?
You know, we are in discussions, epidemiologic discussions. There are numerous cohorts in Israel, those in the Ministry of Health, those in their healthcare systems, and we have seen some of their data. They're actually continuing to analyze the data, and so we're in those active epidemiologic conversations.
My only point is they've made a decision to do boosters based upon their data. And we're saying we're still going to work out through our research to determine. And that's where you begin to lose the trust of the American people in our healthcare experts. In April, the Biden administration announced a $1 billion commitment for sequencing at CDC. To date, only 844 cases from North Carolina have been sequenced according to CDC's website. We had over 1 million cases. It seems there's a major problem again at CDC. Let me just ask you, in CDC's recent updated mask guidance for schools, says communities should use local outbreak data to make decisions. Yet I would challenge you that if only 844 cases have been sequenced, those local people don't have the data they need to make that determination as to what the policy is going to be at a local level. Would you agree?
That discussion is based on cases, not based on variants. So we are actually getting data from around the country based on variants as well, based from the local health departments within North Carolina and with all of the states, as well as academic centers and commercial labs. And the recommendations for schools was based on test positivity and positive cases, not necessarily based on variants.
But shouldn't transparency by the local health department about the variant in their community be important to their decision as to what they do in the schools?
Absolutely, and we have data by region for variants that are posted on our website. They've been updated this morning with the 83%. So not only are we looking at test positivity actually down to the county level, but variants that come in as well from each of the individual states, from the academic partners, from the labs.
Dawn, I know you've only been there 3 weeks. What are your plans to address the pressure that the flu is going to cause on the system?
Ranking Member Burr, thank you for that question. That's been something that we've been, the ASPR team has been considering and planning for over the last several months. There's now an interagency process set up by the White House supply chain coordinator that ASPR's been actively participating in, working with manufacturers of both flu vaccines and COVID vaccines to make sure that the supplies are there so we have access to both vaccines as we head into the fall. But it is something that we will continue to monitor. and recalibrate if needed. So we're sure that we can do both at the same time. At this point, our planning assumptions suggest that we can, but I will continue to monitor that.
Thank you, Chairman.
Senator King.
Thank you, Chair Murray and Ranking Member. Thank you to the witnesses. I want to say a word about